Okay, so before I go to bed tonight, I see this another question on my screen in the WhatsApp. Um, this person is from Pakistan, I can see from the number. So basically requested a quick video on cytomegalovirus. Okay, you really need to know this topic as well. Definitely, this topic sometimes important in the NCLEX. So let's make a quick video on this one. I don't have a whiteboard today, everyone, because I just recently moved from one place to another, my house. So right now, I still need to set up my whiteboard. So what I will do is I'm just gonna use my notes on the other side as a reference, and I'm just gonna read it from there so I can explain this topic to you in a very simple language, okay? So, cytomegalovirus, first of all, remember it's one of the torch infection. Okay, T means toxoplasmosis, O means other infections like syphilis, varicella, parvovirus B19, R means rubella, C means cytomegalovirus, and H means herpes simplex. Okay, now it's one of the torch infection, but the cytomegalovirus is basically common cause of the congenital infection in the newborn. This is something you need to remember, and it comes from the herpes family as well. Okay, now this one definitely spread through the body fluids, so from person to person contact. It could be through saliva, urine, blood, semen, even breast milk as well, right? And definitely easily can transfer from mother to fetus also. So during breastfeeding also this can be transmitted too. Now, once you know the basic information about this one, then you need to know if it's dangerous for the fetus or mother or not. Yes, it could be dangerous, especially if the mother developed this as a primary infection during the pregnancy. This could be risk for mother also, and also for the fetus also at the same time. And the second thing you need to remember is the virus can easily cross the placenta, and it can infect the fetus also and create the congenital infection, as I said. Now, what could be the neonatal effects? So let's see the list. Basically, I can see it has a multiple list in there about the medical condition, but I think you can think in the form of severe multi-system involvement, like many system involvement will be there in the fetus. So for example, intrauterine growth restriction, microcephaly, sensory neural hearing loss as well can be happen to, some visual problems can be happen. Fetus can also have a seizures, jaundice like conditions, anemia, thrombocytopenia, even developmental delay. Like anything could be happen to the fetus if the mother had exposure with this infection during pregnancy. Now, how do you diagnose someone to confirm the diagnosis the cytomegalovirus? For mother, you're gonna check the immunoglobulins like IgM and IgG. If you find them positive in the mother, that means it's the diagnosis confirmed. The second way to check is amniocentesis. So through amniocentesis, you can detect the CMV DNA also in the amniotic fluid. And if you want to confirm in newborn after the birth time when the fetus come out, so in newborn basically you take the urine or saliva sample and you check the CMV PCR test within first 3 weeks of life, and this is how you confirm in there. Now, if I quickly talk about the treatment, remember no effective treatment is available to cure this condition, but antiviral medications, this is something what we recommended. But remember, the antiviral medications we usually give it if it's symptomatic, like usually if the symptoms are there to the newborn. So then you can use the antiviral medication, but it's usually not recommended during pregnancy time. So basically after the birth is there of the newborn. Nursing interventions, or if I talk about some important points you need to know as a nurse, the first thing is prevention is the key. So always try your best to teach the client washing hands thoroughly, especially after handling diapers, saliva, or the toys also even as well. And even avoid sharing utensils, cups, or food with the young children. Use gloves when in contact with the body fluids as well. This is very important. Now, after you think about the prevention, the second thing in nursing intervention you need to know is no vaccination. Usually available for CMV condition, cytomegalovirus in pregnancy. So routine screening checkup, this is only recommended. Number 3, if someone is confirmed with this infection, then definitely you also monitor the fetal growth frequently, and ultrasound findings are also recommended at the same time. And emotional support sometimes parents required, so go for that maybe at the same time. And that's all about it. I hope you find this information helpful. The last thing I want to say is, if ever someone is working as a pregnant woman, a staff member with the client who is infected with the CMV, you always switch the assignment. So there is always a risk for to get it. So if you ever have a question like this also, this is what you do in that case. So now that's all about for this video. If something you do not understand still from this video, please let me know.